이것은 reproductive. 나 진짜 1시간은 진짜 초집중할 거야. 1시간 카운트 해야지. 1시간만은 정말 집중할 거야. 나 진짜 이제 진짜 시작할 거야. 나 이거 읽을 거고 진짜 무슨 일이 있어도 1시간은 진짜 집중할 거야. 할 수 있다. reproductive. First aid, reproductive. Embryology. Important genes of embryogenesis. 1, 2, 3, 4. There's 4 important genes of embryogenesis. 1. Sonic hedgehog gene. 2. Wnt7 gene. 3. FGF gene. 4. Homeobox Hox gene. 1. Sonic hedgehog gene. Produced at the base of the limb in zone of polarizing activity. Involved in patterning along antero-posterior axis and CNS development. Mutation can cause holoprodencephaly. Anterior-posterior axis and CNS development. Produced at the base of the limbs of zone of polarizing activity, ZPA. ZPA makes sonic hedgehog gene, makes antero-posterior axis growth, and CNS development. If there's a mutation, you get holoprodencephaly. Number 2, the Wnt7 gene, produced at the apical epidermal ridge, thickened ectoderm at distal end of developing limb. Necessary for proper organization along dorsal ventral axis. Wnt7 gene is dorsal ventral axis. Dorsal ventral axis. Apical ectodermal ridge at the end of the developing limb makes Wnt gene. Apical ectodermal ridge. Wnt gene makes a dorsal ventral axis. 3. FGF gene, produced at the apical ectodermal ridge, just like the Wnt gene, is also produced in apical ectodermal ridge. FGF gene stimulates mitosis of underlying mesoderm, providing for lengthening of limb. Lengthening. Is it? What is this? It's not anterior posterior. It's not ventral dorsal. Distal, proximal distal. I think this is a proximal distal. That makes a lengthening of the gene. Also from apical ectodermal ridge. Okay, and the last one, Hox, homeobox gene, involves segmental organization of embryo in craniocaudal direction. I think that's also anterior posterior. Craniocaudal direction. Codes for transcription factor. Hox mutation. Appendages in wrong location. If Hox mutation, then the appendages are in wrong location. So the legs are not, like legs are in the head or something like that. Appendages in wrong location, homeobox gene, craniocaudal or anterior posterior direction. Sonic hedgehog anterior posterior, homeobox anterior posterior. Okay, early fetal development, early embryonic development. Within week 1, HCG secretion begins around the time of implantation of blastocyst. Okay. These 6. And blastocyst implant at day 6. Within week 2, bilaminal disc, epiblast, and hypoblast are made. Within week 2, bilaminal disc, epi and hypo. Within week 3, gastrulation forms trilaminal embryonic disc. Epiblast invaginate, make a primitive streak. It becomes endoderm, mesoderm, and ectoderm. Epiblast invaginate, make a primitive streak, which becomes endoderm, mesoderm, and ectoderm. Notochord arise from the middle mesoderm. Overlying ectoderm becomes neural plate. That's week 3. From week 3 to 8 is called embryonic period. Neural tube formed by neural ectoderm and closes by week 4. Neural tube are formed by neural ectoderm and neural tube closes by week 4. And also from week 3 to 8, you make organs. Embryonic period is when you make organs. And this is extremely susceptible to teratogen at week 3 to 8 embryonic period. Week 4, the heart begins to beat. 4-chamber heart, 4 limbs, 4 limbs and 4-chamber heart. At week 4, the upper and lower limb buds begins to form. Heart begins to beat, upper and lower limb begins to form. Week 6, fetal cardiac activity visible by transvaginal ultrasound. At week 6, heart is beating. You can see. No, at week 4, heart is beating. At week 6, you can observe the heart is beating.
Okay, here's what I found online. Please look at the screen.
What the heck? 빅스비가 왜 내 말을 도청하고 지 혼자 뭘 틀지? 그러지 마. With 6 transvaginal ultrasound, you can hear the heart. Week 8, that's 2 months. Fetal movement starts. 8. Gait at week 8. Yay, week 8. Week 10, genitalia begins to form. Genitalia. Okay. Fertilization. Zygote. Day 1, day 2, and 3, and 4. Morula blastocyst. Day 4, morula. Day 5, blastocyst. 6 to 10, implantation. 어떻게 벌써 졸려. 벌써 졸려. 반장했는데. 반장하고 졸립다. 어떡하니. Embryonic derivatives. ectoderm, mesoderm, endoderm. Ectoderm. There's a surface ectoderm, neural tube, and neural crest. Okay. 졸려. Ectoderm, surface ectoderm makes epidermis skin. Adenohypophysis, which is the tongue. Adenohypophysis is the pituitary. And then the Roski pouch is like the invagination of the tongue. And then that makes the adenohypophysis. Lens, epithelial lining of the oral cavity, and sensory organs of ear, olfactory epithelium, canal below the pectinate line, ectoderm, parotid, sweat, and mammillary gland. Okay, and then if there's what's that? Craniopharyngioma, benign Roski pouch tumor with cholesterol crystals and calcification. Neural tube, brain, like the neurophysis, neural hypophysis. This is pituitary, posterior pituitary neurophysis. CNS neurons, oligodendrocyte, astrocyte, ependymal cells, pineal gland, retina. So retina is neural tube. Hi, coming in. Yeah, thank you. Spinal cord, neuroectoderm, think CNS, neural crest, think PNS, and non-neural structures nearby. PNS, like dorsal root ganglia, cranial nerves, autonomic ganglia, and Schwann cell. Schwann cell. Thank you. Oligodendrocyte should know. Yeah. I think so. Oligodendrocyte is from neural tube, but then Schwann cell is from neural crest. Melanocyte, neural crest. Chromaffin cells of adrenal medulla. You're talking about the middle one, right? Parafollicular C cells of thyroid. Oh, that was from neural crest. Calcitonin. Parafollicular C cells of thyroid. 아, 졸려. 졸려. Pia and arachnoid. 그러면 메닌지는 어디 갔지? 미소derm인가? Pia and arachnoid. Bones of the skulls. Bones of the skull also made from crest. 졸려. 어떡해. Odontoblast. That's something teeth. Aortical pulmonary septum. Neural crest. Endocardial cushion. Neural crest. Myenteric Auerbach plexus. Neural crest. Mesoderm. Muscle, bones, connective tissue, serous lining of the body cavities like peritoneum. 졸려. Spleen, and cardiovascular structures, lymphatic and blood. Walls of the gut wall, gut tube. Upper vagina. 졸려. Kidney. Adrenal cortex. Dermis. Testes. Ovaries. Notochord induces ectoderm to form neuroectoderm. Neural plate. Notochord in mesoderm induces ectoderm to form neuroectoderm, which is neural plate. Its only postnatal derivatives is nucleus pulposus of interventricular disc. So the notochord influences ectoderm to make neuroectoderm, which is a neural plate. Not the crest, but plate. Here you go, plate, neuroectoderm, and then that becomes a disc. Nucleus pulposus. 졸려 미치겠다. Middle layer. Mesodermal defect can cause vector. 졸려. V for vertebral defect. A for anal atresia. C for cardiac defect. T for tracheoesophageal fistula. 맞다. 졸려 죽었네. Renal defect. Limb defect. 네, 진짜 이것만 하고 자러 가자. 내 생각에 너 좀 자야 될 것 같아. 자고, 저 이거 어떻게 다 하지, 근데? 모르겠다. 1시간 하고 갔다 올까? 모르겠어. 너무 졸려. 자고 싶다. 아니야. 1시간만 집중하자. 1시간 집중한 다음에 나에게 포상으로 잠을 자겠어. 벌써 15분이 흘렀어. 20분이 흘렀어. 여기서 여기까지 하는데. Types endoderm, gut tubes, epithelium, anal canal, above the pectinate line, most urethra, and lower vagina. Okay, lower vagina, endoderm, not the upper. And most of urethra, endoderm, so soft, derived from urogenital situs, luminal epithelial derivatives, luminal, like lung, like liver, gallbladder, pancreas, eustachian tube, thymus, parathyroid, thyroid follicular cells. And then what is that? Kidney, mesoderm. And then like testes, ovaries, mesoderm. But other organs are so fragile, I'll say. Anyway. Types of errors in morphogenesis. Agenesis. There were aplasia became smaller. Presence of primordial tissue. smaller이 아니고 그냥 primordial tissue가 있다고. Aplasia. Hypoplasia. Incomplete organ development. Disruption. 졸려. Secondary breakdown of previously normal tissue structure, like amniotic band syndrome. Okay, disruption is like an amniotic band syndrome. Secondary breakdown. 졸려 뒤지겠다. Deformation is extrinsic disruption happens after embryonic period. Disruption is like you're born with normal state, but then your mom or someone doesn't take a good care of you, so you end up dying with something simple like DVT. 졸려. Intrinsic disruption during embryonic phase. 좀 더 일찍이네. 3 to 8. Intrinsic disruption. Abnormalities result from single primary embryologic event. Oligohydramnios to polypotter sequence. 졸려. Okay, sequence. Potter sequence. Teratogen. Most susceptible at 3 to 8 weeks. Embryonic period. Organogenesis. Or none. 졸려 죽겠네. ACE inhibitor, renal damage, alkylating agent, 너무 졸려. 그냥 가서 잘까? 한 1시간만 집중하고 가면 안 돼요, 진짜. Aminoglycosides, ototoxicity, anti-epileptic drug, like neurotube defect, diethylstilbestrol, vaginal clear cell carcinoma, and Müllerian duct anomalies are huge. At the bottom, millennial. Okay. millennial. 졸려. 뭔 밀레니얼을 왜 읽었지? Müllerian anomalies. 졸려. Folate neurotube defect, isotretinoin is multiple severe birth defect. And then lithium abstinence anomaly. 졸려. Methymethyl agranulocytosis or aplasia cutis. Tetracycline. The component discoloration. Thalidomide. Bad. Limb defect. Limb death. Warfarin, bone different. Fetal hemorrhage. Abortion, ophthalmoscopic abnormalities. 추워. 졸려. Alcohol, cocaine, smoking, substance abuse, others, iodine, maternal diabetes, methylmercury, vitamin A, and X-rays. Alcohol causes fetal alcohol syndrome, especially intellectual disability. Common birth effects. Cocaine, low birth weight, preterm birth, and IUGR is and then placenta abruption. Okay, cocaine. Okay, and then what else? Smoking can cause low birth weight. 졸려. CO, nicotine. 졸려 죽겠다. Leading cause of developed country, preterm labor, and placenta problem. Nicotine vasoconstriction, carbon monoxide, imperable to delivery. Iodine, lack of access, congenital goiter or lymphoid trivial. Yeah. Where's that church? Is it a church? I'm dreaming. That's why. I'm dreaming. Shit. 졸려 죽겠네 이거 진짜. 그래도 나와의 약속이 있으니까 앞으로 30분만 더 열심히 하자. At least I was reading something. I think that was helpful. I think it just helps me to stay focused on what I'm reading, or what I should read. So, iodine lock or access can cause congenital goiter or hypotension. thyroidism, maternal diabetes, caudal regression syndrome, anal atresia to cyanomelia. 그러네. caudal regression syndrome. 그렇다. 사이렌 되지. 졸려. Congenital heart defect, neural tube defect, macrosomia, 졸려. methylmercury, neurotoxicity, fish, vitamin A, high risk of spontaneous abortion and birth defect, clear blood and X-ray of teratogen is X-ray. Microcephaly, initial disability, minimize local shielding, is shielding. 졸려. 진짜 미쳤다, 졸려서. 까는 거지. Fetal alcohol syndrome, leading cause of intellectual disability, Smithfield term, the vermilion border, small palpebral fissure, and then limb defect and heart defect, heart-lung fistula, and hypoprotencephaly in the most severe form. 거기서 붙이라고 같이 나왔었는데 I'm just keep still thinking about other things when I just fall asleep. Gonna go home and sleep for at least good 2-3 hours and come back. Holoprosencephaly, heart and lung fistula, holoprosencephaly. How can you have, I don't know, failure of cell migration. Okay. Dizygotic, fraternal dizygotic. 졸려. 졸려. Twinning, dizygotic, fraternal twins forms from 2 eggs and 2 sperms. We'll have 2 separate amniotic sacs, 2 separate placenta, or a monozygotic identical twin, 1 fertilizer egg, 3 males, but my uterus at the time was kind of messed up, so the sports bra was going all the way down to the knee. 침이 나오고 난리가 났네. First fertilized egg, one sperm, then split. Early in pregnancy, timing of cleavage determines chorionicity number, chorion, and amnionicity number, amnion. 너무 졸린데? 너무 졸립다. Placenta. Primary site of nutrition and gas exchange between mother and fetus. Okay. Cryptotrophoblast, cytotrophoblast, and pseudosyncytial trophoblast, and the cytotrophoblast, inner layer of the chorionic villi, inner layer is the cytotrophoblast. The outer layer is the syncytiotropoblast. And the inner is the cytotrophoblast, and the outer is syncytiotropoblast. So, yeah. 졸려 죽겠네. 아씨, 40분, 20분 남았네. 아, 진짜 자고 난리야. 심장 떨려. 아이고. 결국에 이거 켜놓고도 잠을 자네. Since your trouble was in a layer chronically, since your trouble was outer trouble was in a layer, since your trouble was outer layer, synthesizes and secrete hormone like human HCG and like LH. Stimulate corpusculum to secrete progesterone. Deciduous basally maternal components, fetal components. Deciduous basally derived from endometrium, maternal blood in lacunae. Umbilical cord, umbilical arteries, deoxygenated blood from fetal internal iliac arteries. To placenta. Umbilical veins supplies oxygenated blood from fetal placenta to fetus into IVC, intravena cava, via liver or via ductus venosus. Single umbilical arteries is associated with congenital and chromosomal anomaly, and umbilical arteries and veins are derived from allantosis. Allantosis, Eurachus, in the third week of the yolk sac forms allantosis. Third week, the yolk sac forms allantosis. Extends into urogenital sinus. Allantosis becomes a urachus duct between the fetal becomes a urachus duct between fetal bladder and umbilicus. So the third week, the yolk sac forms allantosis extends into urogenital sinus. Patent urachus. Total failure of the urachus to obliterate urine discharge into umbilicus. Patent urachus. Uracocyst, partial failure of the urachus to obliterate fluid-filled cavity lined with the urothelium between umbilicus and bladder. Okay. Can lead to infection or adenocarcinoma. Okay. Vesical urachal diverticulum. Slight failure of the urachus to obliterate outpouching of bladder. Vitelline duct. Seventh week, obliteration of vitelline duct. Omphallomesenteric duct. Connects yolk sac to midgut lumen. Okay. Yolk sac to midgut was the vitelline duct, and it gets obliterated by week 7. Vitelline fistula. Vitelline duct fails to close. Meconium discharge from umbilicus. 똥이 나오네. 배꼽에서. 패턴 urachus는 시야가 나오고 vitelline fistula는 똥 나오고. Meckel's diverticulum. Partial closure of vitelline duct with patent portion attached to ileum. True diverticulum. May have heterotopic gastric and or pancreatic tissue. Melana, hemorrhagia, or abdominal pain. Oh, okay. That portion might have like a pancreatic or gastric tissue, which can cause melena or hematochezia or abdominal pain. Aortic arch derivatives develop into a arterial system. First, part of the maxillary artery, branch of external carotid. First is a maxillary artery. Maxillary artery, second stapedial artery or hyoid artery. Stapedial artery, I don't know. First maxillary artery, second stapedial artery, hyoid artery, third common carotid artery and proximal part of internal carotid artery. Common carotid artery and internal carotid artery. Third, common carotid artery and internal carotid artery. Fourth, on the left aortic arch, on the right proximal part of the right subclavian artery. Fourth, on the left, that's right. On the left aortic arch. 졸려 죽겠네. On the right, right subclavian artery. Subclavian artery. Fourth and fifth. Sixth. Proximal part of the pulmonary artery. And on the left, only ductus arteriosus. Sixth. Ductus arteriosus and proximal part of the pulmonary artery. Okay. Pulmonary artery and ductus arteriosus. 저거 뭐지? 컴퓨터 또 터지는 소리 나네. Truncus arteriosus. 6. 오케이. 이것은 왜 중요한 것일까? 모르다. Brachiopharyngeal apparatus. Cleft, ectoderm. Yeah, there's the cleft. Pouch, endoderm. There's the pouch. Arch, therefore mesoderm. Mesoderm. and then neural crest, neural crest. Okay, mesoderm and neural crest. Bones, cartilage, mesoderm, muscle, artery. 잠깐만, neural crest가 bones라고? 아닌, bones of the skull? 그러네. 미소덤도 본 아니야? 봤는데. Bones of the skull. Okay. Cap covers outside to inside. Okay. 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 Cap. That's good mnemonic. Brachial cleft derivatives. First, cleft. We're doing cleft. First cleft develops into external auditory meatus. Second through 4 temporary cervical sinuses. Temporary cervical sinuses, which are obliterated by proliferation of the second arch mesenchyme. Okay, persistent cervical sinus can cause branchial cleft cyst within the lateral neck. Okay, and anterior to the sternocleidomastoid muscle. Immobile during swallowing. Oh shoot. Oh, what the heck? First was external meatus. Second to fourth must disappear, obliterate. But if they remain patent, it can cause cyst, brachial cyst. It's on the lateral neck and is immobile. Cervical sinuses. Cleft. 저기 컴퓨터 너 왜 맨날 그러니? 정신 좀 차려라. Brachial arch. First arch makes cartilage. Everything makes cartilage, muscles, and nerves. And first arch makes a maxillary processes, which turns into maxilla and zygomatic bone, and also mandibular process, which becomes maxill cartilage and mandible and malleus and incus and spinomandibular ligament. 아이고 주여 힘들다. Okay, muscles of mastication. Temporalis, masseter, lateral and medial pterygoid, mylohyoid, anterior belly of digastric, tensor tympani, anterior 2/3 of the tongue. 진짜 컴퓨터야. 왜 그러니? 정신 차려라. 왜 뜨겁게 그러니? 아, 진짜 힘들다. 뭐야? Anterior belly of tintus tympani and myelohyoid. M. Okay. Cranial nerve 2 and 3. Because 2. Second arch. Rachard cartilage. Stapes. Styloid process. Stapes. Styloid process. Lesser horn of hyoid. Stylohyoid. SSS. Stapes, styloid process, stylohyoid ligament, lesser horn of hyoid. 진짜 힘들다. Muscles of facial expression. Stapedius, stylohyoid, platysma. 힘들어. Stylohyoid. Posterior belly of digastric. Stylohyoid. Stapedius. Stapedius. Stylohyoid. And platysma. Posterior belly of digastric. Cranial nerve 7. Abnormalities are Pierre-Robin sequence. Pierre-Robin sequence는 자가 작아요. Micronetia and glossotosis. 혓바닥이 나갔어요. Cleft palate. 자가 만들어지다 말았어요. 엑셀라가 만들어지다 말았어요. Airway obstruction. 저기 Meckel's cartilage 뭐 이런 쪽? 뭐 그런 데가 잘 안 만들어졌어요. Treacher-Collins syndrome. Treacher-Collins syndrome은 neural crest dysfunction. Neural crest dysfunction. Oh my gosh. Oh, hey. I'm good. How are you? Oh, you're fine. You're getting better? Okay, that's good. Yeah.
Doing good yourself, though?
Huh?
Doing good yourself?
Yeah.
Alrighty.
All right.
Well, study away.
Okay. Have a good night. Neural crest dysfunction, mandibular hypoplasia, and facial abnormality. 비슷한데? 트레처콜린이나 피에르로빈이나 비슷하구만. 아이고. Third arch, greater horn of hyoid. Third, greater. Greater. Stylo-pharyngeus. Stylo-pharyngeus innervated by glossopharyngeus. Stylo-pharyngeus. Stylohyoid. Stylo-pharyngeus. Number 9. Stylo-pharyngeus. Glossopharyngeus. Swallow stylishly. 4 to 6 arytenoid, cricoid, corniculate. I have no idea what those are. I forgot everything. Cuneiform, thyroid. Used to sing and act. ACCT. Arytenoid, cricoid, corniculate, cuneiform, thyroid. Okay, fourth arch, most pharyngeal constrictors like cricoid, thyroid, levator valley palatini. 6. All intrinsic muscles of larynx except for cricothyroid. Cricothyroid? Intrinsic. Fourth pharyngeal constrictor. What the heck is pharyngeal? I forgot all these. Fourth arch innervated by 10 vagus superior laryngeal branch, and then 6th arch is also innervated by 10 by recurrent laryngeal branch. 4th is simply swallow, and 6th is speak. Intrinsic muscles of larynx except for the cricothyroid. 4th arch is pharyngeal constrictor, cricothyroid and levator valley palatini. Arch 3 and 4 form posterior 1/3 of the tongue. Arches 3 and 4 form posterior 1/3 of the tongue. Okay. And 5 makes no major development. 3 and 4. Tongue. 6. Tongue. Anterior 2/3. Posterior 1/3. Chia. These are the only cranial nerves with both motor and sensory components. What? Oh. 3, 5, 7, 9, 10. 5, 7, 9, 10. Motor and sensory. When all the restaurants of the golden arches, children tend to first chew, then smile and swallow stylishly, and fully swallow and speak. 뭔가 나한테 냄새가 나는 것 같은 느낌이야. Okay, then it is now time for the pouch. Brachial pouch. First pouch makes the middle ear cavity, eustachian tube, mastoid air cells. First pouch contributes to endoderm line structures of the ear. Okay, ear, endoderm line structures of the ear, middle ear cavity, eustachian tube, mastoid air cells. Ear. Ear tonsil bottom to top. Ear tonsil bottom to top. Okay. Chill. Chill. Second pouch. Epithelial lining of the palatine tonsil. Third pouch. Dorsal wings. Ventral wing. Dorsal wing make the inferior parathyroid, and ventral wing makes thymus. Third pouch contribute to the three structures. Thymus, left, right, inferior, parathyroid. Third pouch structure, and below the fourth pouch structure. Bottom to top. Dorsal is the bottom, and ventral is thymus, and top is superior parathyroid. Dorsal, superior parathyroid. Ventral, parafollicular C cells of thyroid. Ultimate brachial body. brachial body. No idea. Parafollicular C cells of thyroid. Thyroid syndrome. Chromosome 22q11 deletion. Aberrant displacement of third and fourth pouch. T-cell deficiency, thymic dysplasia is aplasia, and hypocalcemia because parathyroid development associated with cardiac defect, conotruncal anomalies. 주여. Hypocalcemia, cardiac with conotruncal anomalies. Cleft lip and cleft palate. Cleft lip and cleft palate. Lip is a failure fusion of the maxillary and medial nasal processes. Okay, formation of primary palate. Cleft palate. Two lateral palatine shelves fail to fuse, or fail to fuse at the lateral palatine shelves with the nasal septum or median palatine shelf. Formation of secondary palate. Cleft lip or cleft palate have distinct multifactorial etiology, but often occurs together. Okay. Maxillary and medial nasal process. Fuse가 못했어. Palatine, lateral palatine shelves thick, or lateral palatine shelves with nasal septum deep. or medium potentials. Okay. 랄랄랄라. 1시간 반 되었습니다. Genital embryology. Okay, female, male, paramesonephric Mullerian duck, female, mesonephric Ophian duck, male. Genital embryology. Save me. Uterine, male, female, genital, homologs. The heck is homologs? Penile abnormalities. Okay. 뭐를 건져? Oh my gosh. 힘내라. 그래도 아까 20분 잤다고 완전 좋아졌어, 몸이. This is anatomy. It's just pure anatomy. Female reproductive epithelial histology. Their histo lab, I need to prep for that. I can do it in the morning. It's a longer lab, so. There's physiology that my son did a math. 주여. pregnancy. Menopause, spermatogenesis, tenor stage of sexual development. Okay. 주의야. Okay, genital embryology. Female default development is the female, and mesonephric duct degenerate, and paramesonephric duct develops. 진짜 뭐가 이렇게 비듬이 생기냐. Male, SRY gene or Y chromosome, produces testes determining factor. Testes determining factor. Testes develop, and then testes Sertoli cells from testes secrete Mullerian inhibitory factor. Sertoli, Sertoli, Surly likes milk. Mullerian inhibitory factor, MIF. Surly likes milk. Okay, I'll never forget that. Sertoli cell and milk, MIF. Okay, Mullerian inhibitory factor suppresses development of paramesonephric Mullerian duct. Leydig cells from testes secrete androgen testosterone, stimulates development of mesonephric duct. 사진 좀 봅시다. Indifragonate mesonephrosis, gubernaculum, paranephrotic duct, mesonephric duct. Okay, your genital sinus, whatever. 진짜. 내 컴퓨터가 폭발을 하려고 그러네. 참 이게 좋은데 지금 잘하고 있는데 이게 컴퓨터가 폭발을 하려고 그래. 아, 이거 어떡하나. 거의 히터 수준인데 어떡하지 쟤를. 진짜 컴퓨터가 왜 그러니 너 진짜. 그러기니 그럴 거야. 37%밖에 안 되고. 뭔가 좀 많이 이상하네, 컴퓨터가. 띵. 아이패드로 하고 싶은데 아이패드로 되지도 않고. 컴퓨터만 해야 된다고 그러고. 찡. 오케이. 아, 이제 그만해도 되지 않을까? 왜냐면 나름 열심히 1시간은 했고 되게 열심히 했어. 그러니까 이 기세를 몰아서 더 이상 내 컴퓨터 때문에 이거를 할 수가 없을 것 같아. 에이 젠장. 컴퓨터 때문에 유튜브를 더 이상 찍을 수가 없어. Yes! End!